I am Dr. Jaysee, Assistant Professor, Department of Anatomy, JAYOTI VIDYAPEETH Women's University, Jaipur. So today we will discuss the anatomy of superior vena cava. So first we will see what is the superior vena cava and what is the function of it and what is the blood supply of the superior vena cava. Then the applied anatomy of the superior vena cava. So superior vena cava brings the deoxygenated blood from the head and neck, and also the upper limbs and thorax to the heart, and drains it into the right atrium. So the deoxygenated blood that is carried by the superior vena cava towards the right atrium of the heart. So it is the main function of the superior vena cava. Now we will see the formation of the superior vena cava. So we will see that it is formed by the union of right and left brachiocephalic vein behind the lower border of the first right posterior cartilage, close to the sternum. So it is formed by the at the level of the sternum, and where it is at the lower border of the first right posterior cartilage. Now we will see how the brachiocephalic vein is also formed. So brachiocephalic vein is formed behind the sternoclavicular joint by the union of internal jugular vein and subclavian vein. So this is formed by two brachiocephalic vein to the superior vena cava, and brachiocephalic vein is formed by the internal jugular vein and subclavian veins in two sides. Now what we will see the course of superior vena cava. So at the lower border of the right first costal cartilage. So we will see that the formation of the first costal cartilage. So it will start from here. Then it will open into the right atrium at the lower border of the right third costal cartilage. So it will drain into the right atrium. So at what point? This is the point where the lower border of the right third costal cartilage is situated. Okay. Now we can see in this diagram. So this is the diagram. This is the sternum. This is the manubrium, and this is the clavicle here. And this is the joint of manubrioclavicular joint here. And this is the first costal cartilage. You can see that the level of the first costal cartilage, and this is formed. So this is the internal jugular vein, and this is subclavian vein, and they will form the superior vena cava. So this is the superior vena cava. Okay. Now the external appearance of the superior vena cava. This is the 7 centimeter long, and the diameter is 1.25 centimeter. So it lies in superior and middle mediastinum. So in middle mediastinum, there is the heart. So it will drain into the heart. So the last point of the superior vena cava that is situated in the middle mediastinum. Now it has two parts. One is the extrapericardial part, and second is the intrapericardial part. So this name suggests that some portion that lies inside the pericardium, that is called extrapericardial, and some portion that is lying inside the pericardium. So that part is called intrapericardial part. So this extrapericardial part that is lying in superior mediastinum, and intrapericardial part that lies in middle mediastinum, that collects blood from the upper half of the body and drains it into the right atrium. Okay, and it is already we have seen. Now we will see the two parts of the superior vena cava. One is the pericardial part, and second is the intrapericardial part. Pericardial part is lying in superior mediastinum, and the intrapericardial part is lying in middle mediastinum. Now we will see the tributaries of the superior vena cava. So right and left brachiocephalic vein, it is the first tributaries of superior vena cava, as the superior vena cava is formed by the right and left brachiocephalic vein. So this is the first tributaries. Second is the azygous vein. So azygous vein arches over the root of the right lung and opens into the superior vena cava at the level of the second costal cartilage, just before the latter enters the pericardium. And despite of all these veins, there are several mediastinal and pericardial veins that also drain into the superior vena cava. Okay, so these are the main tributaries and some small tributaries also. Now we will see the formation of the brachiocephalic vein, and we can see there are two brachiocephalic veins, one in the right side and one in the left side, and they both are formed by the internal jugular vein and the subclavian veins, and where it is located, it is just behind the sternoclavicular joint. Now we will see the relation. So we have seen the picture. This is the superior vena cava, and we can see there are many other structures that is situated in front of the superior vena cava and behind the superior vena cava and either side of the superior vena cava. So we will see the what are the structures that surrounding the superior vena cava. Okay. First, we will see in posteriorly. So, in posteriorly, we will see the trachea. Then we will see the right pulmonary artery and the right bronchus. So, in posterior side, these structures, trachea, pulmonary artery, right bronchus, will situated posteriorly or behind the superior vena cava. Now we will see the right side. In right side, there will be the right phrenic nerve and pericardiophrenic vessels that supply the pericardium and right lung and pleura. And if we will see the left side, then we will see the ascending aorta and brachiocephalic artery. Okay. On anterior side, we will see the right internal thoracic vessels and margin of right lung and pleura and chest wall. We will see the right and the pleura is situated in the right side of the superior vena cava. It is not they are complete right lung and complete pleura will situated in the right side of the superior vena cava, but the some portion of it that will situated in the right side of the superior vena cava. But some portion we will see the margin of right lung and pleura. So some portion of it that also situated the in front of or anteriorly the superior vena cava. Anteriorly, anteriorly we know that chest wall is there. Okay. So we have mentioned here also in clearly that anterior side, right internal thoracic vessels, margins of right lung and pleura, and just one, and posterior side, the trachea, and there will be a pulmonary artery, right side pulmonary artery, and right bronchus. Left side, we will see ascending aorta, brachiocephalic artery, and then right side, the right phrenic node, pericardiophrenic vessels, and right lung and pleura. Okay. Now we will see the applied anatomy. So, what is the problems that will create in superior vena cava and how it will affect the surrounding structures and the complete body? So first we will see that what will happen if there is an obstruction in the superior vena cava and there is another obstruction uh, happens in this pathway. So what will happen? And how the development of collateral pathways happen. So first we will see the superior vena cava is obstructed at two sides. So first obstruction will be above the opening of a gyrus vein, and second will be below the opening of a gyrus vein. And what is a common cause of these obstruction? So first common cause of these obstruction is the cancer or the malignancy. Okay, the primary or metastatic cancer in the upper lobe of the right lung can compress the superior vena cava. So if there any tumor, any malignancy in the right lung that is situated right side of the superior vena cava and front side also. So in this side, if there is a tumor and big malignancy can compress the superior vena cava. And lymphoma, other tumors that located in the mediastinum also can cause compression of the superior vena cava. Okay, so we can see this is the lung and this is the cancer and this is the superior vena cava. So how this malignancy, how this tumor compress the superior vena cava, we can see very easily in this diagram. Okay. Now, what are the symptoms that will arise after the compression of the superior vena cava? So we can see the all the symptoms or signs in this picture. As we know that the superior vena cava carried the blood from the upper side. Now it is blocked, compressed. So this whole blood is not drained by superior vena cava content. So what will happen here? So there will be the accumulation of the blood, and so it will seen by many signs as swelling of the upper arms and torso. So there will be the swelling of the upper arm and torso means this is the upper chest side. Edematous head and neck with nasopharyngeal edema. So there will be edema in nasopharyngeal region, and there will be the appearance of collateralized chest wall veins and cyanotic appearance of skin. There is the bluish color of the skin will appear here. Okay. How collateral pathway will develop in this case? So we'll see. If superior vena cava is obstructed above the opening of the gyrus vein, the venous blood from the upper half of the body is shunted through the right atrium through a gyrus vein. And main collateral pathway are provided by the superior intercostal vein. So we can see in this picture so how this collateral pathway will carry all the blood from the upper part of the body into the heart. Now, if superior vena cava is obstructed below the opening of the gyrus vein, the venous blood from the upper half of the body is returned to the right atrium through the inferior vena cava through the collateral pathway and formed between the tributaries of superior and inferior vena cava. And this formation of the pathway is called caval shunt. So we can see this is the superior vena cava and this is the inferior vena cava, and a collateral pathway is developed in the tributaries of the superior vena cava and inferior vena cava. And this pathway is called caval shunt. Okay. So this is the caval shunt that is the developed in between the superior vena cava and the inferior vena cava. Okay, so this is all about the anatomy of the superior vena cava. We have discussed the formation of the superior vena cava and what is the location where it is formed. Then we have discussed the parts, external appearance of the superior vena cava. Then we have discussed the applied anatomy and what is the function of the superior vena cava. Okay, so this is all about the superior vena cava. This is the very important vein of the heart and our body also. Thank you so much.